Well, it's 9 a.m. I wanted to officially welcome you to our second in a series of social service workforce strengthening webinars. These webinars are organized under the auspices of the Global Social Service Workforce Alliance and funded by PEPFAR and implemented by our partners at Capacity Plus. The focus of the webinar today is on curriculum and training programs for frontline social workers. So we will be talking to quite a few experts and practitioners and trainers from a few promising training programs from different parts of the world, and as well as hearing, we hope, from many of you about your training experiences. I wanted to maybe make a few comments on our last session. 2 months ago in July, for our first social service workforce strengthening webinar session, over 100 people from 18 countries we know of logged on to our webinar. And the last webinar focused on exploring lessons learned from the health sector workforce strengthening efforts. And information about that webinar is available on ovcsupport.net. On ovcsupport.net, you'll also find resources to support just about different programs that are going to be featured on this webinar, as well as information on future webinars, and that's where we are going to also put the link to the recorded session for this webinar. So I wanted to just note that we are joined today at this point by at least 39 participants, including I wanted to give a special welcome to our country teams that are joining our webinar in I think 11 different countries today. And for those of you all who are not participating in this webinar as a country team, please know that country teams are gathering at places in the countries that are listed on this particular slide. And if you want to join a team of people that are working on social service workforce strengthening in those countries, you can contact those fantastic focal persons that are listed on this slide and learn a little more about how to participate in these webinars together and how to become engaged in those efforts. So just to tell you a little bit about what's going to happen today, our panel chair this morning is Nathan Linsk, and Nathan joins us from the University of Illinois at Chicago, where he's involved in a range of different efforts, including training for parasocial workers in Tanzania and in Ethiopia. Our first presentation today is going to be given by Kathy Scott, who is the National Training Director at the National Association for Child Care Workers in South Africa. And she's going to talk to us a little bit about the child and youth care work training that they've developed there, that they are offering in South Africa. After that period, after that presentation, we're going to provide a short period of time for some clarifying questions. And that period of question and answer is going to be facilitated by Jim McCaffrey from Capacity Plus. And so I wanted to remind you that throughout this webinar, you're invited to send in questions or thoughts as they come to you, as you're inspired by our presenters, and we'll be collecting those questions and inviting presenters to respond to those questions during that question and answer period after the presentation. Our second presentation this morning will actually be given by Nathan Linsk. Unfortunately, Leah Omari from the Institute for Social Work in Dar es Salaam was not able to join us today, but she developed a presentation with Nathan, so Nathan's going to give it on her behalf. And she's going to talk a little bit about the parasocial work training that they're providing in Tanzania. Once again, we'll provide an opportunity for clarifying questions, and then our final presentation will be provided by Lynette Mudekunye from REPSSI, from the Regional Psychosocial Support Initiative, which is working throughout Southern Africa to provide an accredited certificate training course on community-based work with children and youth. This is a distance learning course, and she's going to talk to us a little bit about that. So we'll also, after that presentation, provide yet again another period for clarifying questions, and then hopefully have lots of good time for discussion. And we want to provide that discussion time as an opportunity for you all to talk about your experiences with training, any further questions you have for the presenters, any other issues that you would like to raise. Finally, our panel chair, Nathan Linsk, is going to provide a few closing remarks, and we'll sign off until our next webinar session, which will be held, we think, potentially in November. So we'll talk a little more about that at the end of this webinar session today. So I just, again, wanted to remind you that you can feel free to continue to write questions or comments in the chat window throughout our webinar. And we're, as I said, going to do our best to respond to those questions following the presentation. And so at this point, I'd like to invite our panel chair, Nathan Linsk, to begin to provide us with a few opening remarks and just kind of provide us a context for this webinar session today.
Okay, good morning or good afternoon, as the case may be. We're very excited about the webinar today, and I'm going to tell you a little bit about how we chose the topic and what's going to be coming forward in terms of the webinar today. This topic is one of those issues that was very lively discussed at a social welfare workforce strengthening conference in Cape Town in November of last year. And some of the things that were brought forward at a special session on curriculum and training is how do we develop and implement curricula for frontline workers? What do we know and who's done what, and how can we share the existing curricula or adapt them, how to access them, and how we can move ahead without constantly reinventing the wheel. So this was the genesis, I think, of the webinar, but also we conducted a survey following the conference, and I know many of you on the webinar today were at the conference. We conducted a web survey, and this topic was also identified as a key priority in the post-conference survey. So we selected this topic, which I think follows very well from the July webinar on lessons from the health sector. So what do we mean by the social service, or sometimes called the social welfare workforce? And this is kind of, to me, every once in a while some new terms kind of begin to float around in our field of working with people who are vulnerable and needy. And this has kind of become a new buzzword, even though it's not a new concept. The concept really is defined broadly. The social service workforce describes a variety of workers, paid and unpaid, governmental and non-governmental, all who staff or support the social service system and contribute to the care of vulnerable children and their families. So this is a key issue globally in terms of how to attract and retain qualified workers. And we know that in various parts of the world, there may or may not be existing structures for the social welfare or social service system, and where there is such a structure, it's hard to fill positions and sustain people in positions. Some of the estimates are that within Africa, between 50 to 60% of those positions are vacant, and half of those who are employed leave their jobs within 5 years. So this is a big concern. Some of the challenges in the social service workforce include how to plan, develop, and support the existing workforce. What are the staffing plans? How to define them appropriately? How to develop realistic implementation mechanisms for the social welfare workforce? And also, how does that interface between the various sectors, the government sector, the NGO sector, and other sectors as well? Another challenge is opportunities to meet the demand for social welfare workers in terms of education, and the burnout rate because of the difficult issues and the limited resources working with these populations. So this webinar focuses specifically on education and training for community-level frontline providers. And we are talking about the community level because these are folks who are living within the community with various auspices who can work directly with children and families or help to manage services that they are taking advantage of. Some of the strategies that have been developed to address workforce development among frontline workers include how do we align education and training in workforce planning efforts? How do we incorporate local needs and information, sometimes as we're planning for a larger system or an entire country? What are the best practices and how we use them to improve the well-being of children and families? How to strengthen those who teach and train those who are going to provide the services, training of trainer models and other teaching models, how to ensure adequate supervision of the workers, because these frontline workers, by definition, are not independent practitioners and they haven't had a lot of education, so how do we continue to provide monitoring and supervision, and how to provide flexible in-service training opportunities. And throughout the webinar, we're going to talk about resources and websites that will be available to help find information and utilize information. If you haven't seen it, you should go to ovcsupport.net for further information on training strategies, and the web address is there for your use. And I remind you that because the session will be recorded, you can always go to ovcsupport.net and access the notes from this meeting or in the entire webinar, and that will give you some information, and you can get back and see that website. So some of the challenges are, what are the resources for education and training? And resources can be financial resources, human resources, materials, how to access materials, and one of the really tricky things is how to harmonize across varying projects, because one of the things that we've learned is that various projects oftentimes develop their own materials. Then how do we integrate this with government programs, schemes of service, job descriptions, so the service programs administrator at other levels? Do we certify these workers? What does it mean to certify them? How do we certify them? How do we ensure that they're maintain appropriate practice? So either accreditation programs or not, and we're going to learn about some of the ways that this has been addressed today. And then how do we support the workers? What incentives are provided? Are there salaries provided? Do they have supplies? Do they have the basic things that they need? What about transportation and other kinds of help? And I think I've already mentioned supervision. So today we're going to have 3 presentations. So each of us, in presenting a particular program that's working on some of these issues, will describe the program and the curricula that's used for that program, explain how it was developed and tested, discuss what has been the impact of the program, comment on how and to what extent the program has been institutionalized and accredited, explain some of the challenges and lessons learned, tell us something about how to access and implement the program, and provide some advice that we have for others who wish to develop or implement training programs for frontline community care and parasocial workers. Okay, so I want to move right ahead and introduce Kathy Scott. And as Maury told you, she's the National Training Manager for the National Association of Child Care Workers in South Africa. Kathy?
Thank you very much. Welcome. Well, good morning to everybody. As mentioned, I'm from the South African National Association for Child Care Workers, and I'm going to be presenting on our child and youth care training. Just to set up a bit of a contextualization, where our training is part of our developing and training a children's workforce in South Africa. And we're training child and youth care workers, or what we could also be called social pedagogues. These are people who are working directly and do life-based work with children. They work hours to fit the children's needs. They do not work a standard 8 to 4 day. They work when the children are there. So they would be there in the mornings, and they would also be coming there in the afternoons when the children come home from school. They also work with children in various contexts or different settings, such as child and youth care centers. They can work with families and families in their communities. They can be with children in community parks. They could be working with children in courts, in schools, and in health facilities. The people that we are training are generally unemployed, rural women learners. And this makes up about 98 or 99% of the people that we are training at present. We often talk about our learners as being wounded healers, in that they are very often the people who come from the same community as the children who they will serve and have experienced the same sort of hardships. And an example of this would be the child bride culture in KwaZulu-Natal. The other important aspect is that we go to where the learners are. We don't bring the learners into the city or into urban areas. We go to where the learners are, and we train where they are in their own communities. So we would be training in local churches, in community halls, venues, safe parks. We've even trained in tents and under trees. But at the same time, what we do definitely make sure of is that we make sure that all accreditation standards are complied with in terms of the FETA. The training that we do is part of a parallel process in that we make sure that the way we train demonstrates the principles of child and youth care practice in training. So when we talk about working in the moment, our trainers would also be modeling how to work in the moment with children. Our trainers themselves come from the professional practice of child and youth care workers. They are all have worked in child and youth care work, they are experienced child and youth care workers, and they have a lot of personal experience to draw from. Our methodology is creative, and we try to integrate the learning by using experiential methodology, animation. We're extremely responsive to the language, the local language and the culture, and we obviously need to be aware of the pace of learners and need to manage that, and we adapt to the learning reality. And the other thing that we do very carefully is while we're training, we also identify people from the learners who could then become the next round of trainers, so that we actually look at leadership development. The curriculum, the focus is on child and youth care work. And we have created at the National Association of Child Care Workers a continuum of learning programs in a career pathing process. So we could start off with a basic qualification in child and youth care, which is not accredited, and we have other non-accredited training courses which lead up to our accredited training. Our accredited training is a further education and training certificate, or known in South Africa as an FETC. It's level 4, which means it is on the same level as the end of our high school in South Africa. And within the certificate, there are 14 core child and youth care modules. After the FETC, or the Further Education Training Certificate, people could access a child and youth care degree, which at present moment is being offered by the Durban University of Technology and was at one point offered by UNISA. Just to give you a bit of background or some information on the Further Education and Training Certificate, the learning program is designed to meet the requirements of accredited training in South Africa. In South Africa, the education system was changed into outcomes-based education, and the National Association of Child and Youth Care Workers agreed to offer a program which would be designed to meet these requirements. There are various modules within the certificate, and each of the core modules is developed against what we call a registered unit standard, which is a block of knowledge which learners need to be able to, they need to know and be able to do by the time they have finished it. And the modules are delivered in a particular order in order to build on knowledge, so that at the end of the day there's knowledge that is assumed to be in place, and learners are required to complete tasks during and after the training, demonstrating that they have integrated their learning. As mentioned before, we train in the communities, and we also comply with all accreditation standards of the Health and Welfare FETA. There are, as I said before, there are 14 core child and youth care unit standards within the FETC. There's also requirements by South African qualification requirements, which are literacy and numeracy unit standards, and learners are also required to do one elective, such as learning around HIV and AIDS, substance abuse, or community development. The core modules, just to give you some idea of what the core modules contain, the first one would be the fundamentals or foundations of child and youth care work. Then we move on to communication skills, and then how to promote and uphold rights of young people, and then how to provide basic care of children and youth. After that, we start looking at the developmental theories in child and youth care work, such as Erickson and Maslow, and then we move on to the developmental approach. After this, we start looking at interpersonal skills, how to develop relationships in child and youth care work, the critical focus on teamwork, and we look at both the child and youth care team there and the multidisciplinary team. And then a very important module is the personal development, where people are encouraged to look at themselves. It's a thread that actually goes right throughout the training of self-awareness. And then we look at observing, reporting, and recording, and program and activities. And then the last two modules, the one on basic behavior management techniques, and then developmental assessment. As I mentioned before, the curriculum was developed in the context of the South African outcomes-based education. There are national requirements in South Africa for the establishment of the qualifications, and a standards-generating body of elected stakeholders in the child and youth care field develops the qualification. The National Association of Child and Youth Care Workers is an accredited service provider with the South African Health and Welfare Sector Education Authority. And we've been accredited as a training provider, and our learning material has been accredited as well. And the material is obviously then designed towards the registered unit standards. And we have been using this material to train all our workers in our ISIBINDI model. The impact, at the present moment we have just over 100 registered trainers. We have just over 40 assessors. 12,642 learners have been trained since 2005 in one or more modules of this qualification. In our ISIBINDI model on its own, we've had 1,240 learners registered to do the whole qualification. And in South Africa, we're very excited that the Minister of Social Development, in terms of the job creation plan for the country, has decided to replicate our ISIBINDI model, and by doing that, to train up and skill up 10,000 child and youth care workers in 400 ISIBINDI projects, which will mean that 1,200,000 children will be served through this. The institutionalization of the program, there's been a lot of advocacy by the National Association of Child and Youth Care Workers, led to this qualification being registered on the National Qualifications Framework. Before that, there was no recognized qualification. The further education training certificate is a required minimum qualification for employment in state and increasingly in the private sector in South Africa. Child and youth care work has been recognized in the Children's Act at the moment in the country, and there has been recognition through the Minister's Plan particularly of the need for statutory regulation, and also that the workforce now needs to be organized. The access to the training program, at present we have non-accredited training that Zambia, an association in Zambia, the Zambian Association of Child and Youth Care Workers, is using our basic qualification for child and youth care workers. And what we've done there is an incremental development and empowerment of their trainers. They are trained as trainers, they train the material themselves, and we're looking at them taking on more of our non-accredited training, and we would be happy to do this in other countries as well. The accredited training, I think we would need to discuss carefully as to how we would move on that, just because of the legalities around it in our country. Some advice: we would feel that it's very, very critical that people who train this understand the child and youth care profession and the practice. In other words, what we talk about as life-space work. As mentioned, our trainers are all qualified child and youth care workers and know the practice. So we would be very much saying this is what needs to be done. The trainers and whoever delivers this need to understand child and youth care. Secondly, children need to be the focus of training. Whatever we do and however many people we train, at the end of the day, the impact is on how many children are being served. And the fact is that we're trying to develop a children's workforce. Trainers need to be developed effectively, and they need to be mentored and supported through this. And also, the training needs to be integrated into good models of practice, like we have done with our ISIBINDI. And then to make we need to make learning meaningful. It needs to be transformed. It needs to be linked to the context in which the learners are. So sort of a Paul Freire approach. Okay, thank you very much.
Hi, this is Jim McCaffrey, and we'll be taking 10 minutes for questions to Kathy from her presentation. We've got several of you have written in questions, and so we'll start with those. And we might start with the basic one, Kathy, that would be helpful, and that was somebody asked, is NHCCW an NGO? It's been answered. So Maury, tell us what the answer. Is the one? I don't know. There was one about. What is the unit cost? Kathy?
Sorry. Are you asking about the cost of the accredited training? The cost of accredited training comes to about 12,000 Rand per learner, which would include all the training, the assessment tasks, the moderation, and the verification and endorsement by the Health and Welfare CETA. And that's the very reason why we would say we would need to discuss this for countries outside South Africa, because not all of that may be required.
Okay. Another question is, what happens to them after the training program is over? Is the intent that they, in fact, be absorbed by government or other entities?
Generally, what would happen is that they would either find employment in the non-government sector, or they could go into government or into a variety of settings: educational, health, community, other community settings.
Okay. Is there any sort of minimum qualifications to these courses?
For the accredited training, we ask that people do have language ability, English language ability, at around about what the Health and Welfare CETA call level 3, which is around about our standard 8, grade 10, but that people can speak and write English. For our non-accredited training, that would not be such a heavy requirement.
Okay. What's the relationship between qualified social workers and child care workers?
This is Jenny speaking. Social workers are an identified profession functioning at both professional and at auxiliary level in South Africa, and the intention is that child and youth care workers are a parallel profession functioning at auxiliary level and at professional level in South Africa, even though our degree for child and youth care is not as advanced as social work. However, our methodology is life space work, which is different to social work. So we see ourselves as a parallel profession, and in South Africa, in our Children's Act, we're defined as social service professionals.
Okay, and I should say, as we move along here, I notice in the chat room that some people are actually commenting to each other on the questions, and this is good. And if you have thoughts or want to build on what either Kathy or Zenny said, or what other questions are there, please feel free to do so. So let me go on to another question. What is the role of the government in this particular training program?
Our government has demonstrated their support for the development of child and youth care workers. I think, as Kathy alluded, the Minister's plan to develop 10,000 child care workers, which is at the moment going to be funded for by the department, I think demonstrates, the interest in developing a children's workforce and a child and youth care workforce to support social workers in South Africa.
Yeah, we'll take a couple more. We got another 4 minutes or so. there have been a couple questions about the impact of this. Has there been any studies done to ascertain the impact on the quality of children's lives who've been served by this particular group of graduates?
I think we've had the experience of developing the Isibindi model, which has demonstrated the role of child and youth care workers in communities, particularly rural communities. The model has expanded with the support of PEPFAR and USAID funding to the point that we have 67 Isibindi projects servicing more than 84,000 children in South Africa. There have been various pieces of research undertaken in terms of the success of the model. And I think this is what has resulted in the Minister's interest in replicating the Isibindi model. It has demonstrated successful responses to children in rural communities with the deployment of trained child and youth care workers to support children and vulnerable families.
Let me follow up with a quick question related to the rural part of what you just said, and that was, how do you train in rural settings? Is it formal or informal? And can you please say a few words about that?
We take the accredited formal training into the rural communities and we train them in their context. It's quite critical that we train, as Kathy said, in local churches, in traditional authorities, accommodation, in tents, wherever people are. So we recruit people from rural areas, we train them in rural areas, we generally train them with people who have local language skills, even though the training is in English, and they result in receiving an accredited certificate in childcare. So we have managed to work in the realities of informal rural communities and take in quite advanced and sophisticated accredited training to them.
Okay, well, just a last question, at least in this round, and we'll have a time to ask questions or discuss at the very end also after we've heard all three presentations. But you mentioned in your presentation about Paulo Freire, and there was a question about what is that approach. Can you explain a little bit further what that means?
I think we're talking about learning, transforming people in a parallel process. I think when we accept the fact that people learn in their own context, and if we're wanting to have childcare workers in rural communities, for example, to be relevant to the children that they service, we need to be able to look at what is their environment, what is their context, and how can we find both the strengths and the challenges in that context that they can respond to. We believe that learning is not distant and separated from the realities of people, and it's transformational learning that actually helps people transform their own lives, transform the lives of the community around them, as much as they're learning about child and youth care and are going to apply that knowledge specifically to children who are vulnerable. So I think we're looking at much more holistic learning that is actually relevant to the context of where people come from.
Okay, thanks very much, Kathy, and we appreciate your both presentation and the answers to the questions, and especially the last one about the intent for this to be transformational and holistic. We're going to move on from there to switch to the training of parasocial workers and looking at twinning as a part of that, and what's going on there. And as Maureen mentioned at the beginning, Leah Omari has put the slides together and worked on this, but has had a kind of a family emergency, and so Nathan is going to stand in and do the presentation. So with that, Nathan, you want to take it?
Sure, and I do send apologies from Leah, who really wanted to be with us today. Just a word about the Twinning Center. Jim mentioned the Twinning Center. The Twinning Center, through the American International Health Alliance, supports projects in a number of the countries that are represented today. And the projects are both in the health sector, but there are a number of projects that are in the social service sector, as well as focusing particularly on vulnerable children and families. So we're going to tell you a little about one of those today. So we'll start with our project's model, which is Watoto Kwanza, which means children first. And you can see that we try to focus on the needs of the children and their families throughout the program. The need for paraprofessional training in Tanzania is extensive. Approximately 18% of children under age 18 are considered what is called most vulnerable children, which is a term that is used as much as possible in Tanzania, as opposed to orphans, particularly because that sometimes is seen as pejorative. Child vulnerability could be for a number of reasons, including HIV/AIDS, and I think the rest of what's on this bullet is going to look fairly familiar to you because I think that some of these issues and needs are typical of many of the countries that we're working in. There, in the past, had been over-reliance on institutional care and the development of private orphan homes. The government policy is family-based and community-based care, and so this program is an effort to work towards that objective. The good news about Tanzania is there is a social welfare system as part of the Ministry of Health and Social Welfare. The challenge is that the system is overstretched. So when we started this project, of the 60 or so districts around the country, at least half of them did not have a qualified social welfare officer, which is what the social workers are called, to provide support. So this was an effort to try to fill some of that gap. Since that time, the number of professional workers has increased somewhat, but the idea of parasocial workers or paraprofessional social workers has really sort of caught fire in the country and is doing a lot to fill that gap. The project was based on a number of previous needs assessments and also by an initiative and some leadership from the USAID mission director at the time, which meant that we had to start this program very quickly. We had to utilize existing assessments rather than conducting our own assessments, and we had to put the project in place and scale it up as quickly as possible. We did seek input from other stakeholders and participants. In the materials that were sent out to people in advance, there are a couple of items that I want to call your attention to, one of which is an article in Child and Youth Services Review, which really reviews the pilot phase, the first 500 parasocial workers who were trained. Since then, there has been extended work together, joining with Capacity Project and others to implement the program. So the term parasocial worker refers to an individual who has received training to assist in the delivery of basic foundational social welfare services. We spend a lot of time talking about what's appropriate for a parasocial worker to do and when a parasocial worker will need to engage others. So complicated mental health, complicated child protection issues. The focus is really on referring to other services and programs that are designated in the child law in the country rather than providing the services directly. So as I'm going to talk about, it's really a case management model. What's listed there is sort of an abbreviated version of the social work process for intervention, or the parasocial work process, but it's the social work process, intervening with orphans and vulnerable children and their families. And the focus is on assessing needs, providing care and support, and referral. And we'll talk a little bit more about that. Here we have some photos of some parasocial workers at work or parasocial workers involved in training. We want to keep the focus as much as possible on the people who are involved. As the model has matured a little bit from its initial stage, the focus has become very localized, to focus on local government relationships at the ward and village level. So the parasocial workers actually are identified by leadership at the local level. They are nominated to come to training programs, as well as individuals who will be their supervisors. So we train the parasocial workers and the supervisors together. The supervisors have additional training, an additional 4 days as part of the training. There are really 3 major program components. The first is a 9-day introduction to parasocial work. It's 9 days. It's about 75 hours of training. So the training is pretty intense. Following that, the parasocial workers go out into the field for a practicum of up to 6 months under supervision of one of the supervisors who's trained them. So they come in teams and they go out into the field and work in teams. Then they come back for an additional week full of training, a Parasocial Work 2 course. And I'll tell you just a little bit more about each of those as we go along. The participants receive certificates of attendance for all of the program components, and then they receive a certificate at the end of the 3 stages of program indicating they are now parasocial work. There are plans to develop a national standard and a national curriculum that goes a little bit beyond where we are now in terms of getting input from others, although the curriculum is just in the process of being updated and revised. And at that point, there may be a more formal type of certification. So here is the training content for the Parasocial Work 1 and the Parasocial Work 2 courses. This is outlined in some detail in one of the additional handouts that was sent out to you in advance. But there are basically 2 or 3 streams as part of this curriculum. One is the social work process, which the way we conceptualize it is identifying and outreach to vulnerable children, engaging communication with vulnerable children and their families, assessing needs and strengths, and we put a lot of focus on assessment, that it's not just providing the service a person comes in and asks for, it's trying to do some kind of comprehensive holistic assessment, developing and implementing a service plan, and then the 5th stage is ongoing case management, advocacy, and support. As they learn this, they also are exposed to legal and policy issues, which are important for them to know about. And in addition to that, they receive supplemental content on human development. We call these pieces the life of a child, part 1, part 2, part 3, and part 4. Part 1 is human development. Part 2 is dealing with crisis and trauma. Part 3 is addressing stigma and discrimination. And part 4 is identifying and addressing grief and loss issues. So as we listen to Kathy, there's a lot of parallels between these curricula. Other topics are also woven throughout the training, including parenting issues, how to take care of yourself, how to work with a supervisor, how to develop a plan to go out into the field. The other thing, well, I'll come back to that in just a minute. The training methods are indicated here. What we call content discussions, which use PowerPoint slides to discuss basic kinds of issues. Although a lot of the training, particularly in the afternoon, the morning may be a content presentation and a bunch of interactive exercises, but in the afternoon they work in what we call skills building workshops, where they work in groups, the same groups throughout the course of the training, and they have a particular case they continue to work with each day, applying the lessons that were learned in the morning discussion to that particular case. They also have a skills workbook where they have written exercises they need to complete and need to bring in the results of that on a daily basis. They have to complete 5 of the skills in order to complete their certificate for the Parasocial Work 1 course. So we try to make this a competency-based program. It's also, to whatever extent we can make it transformative and interactive, and some of the techniques we use are listed there. They receive a manual. We have a number of service tools. The basic assessment tool is the Child Status Index with some supplemental questions that they ask. They also use eco-maps, case identification tools, case management service plans, and some other issues as well, particularly to become aware of services in their community. And some of the numbers are there for you to look at. To date, we've trained more than 3,000 parasocial workers, 500 social work supervisors, where there's not time to talk about our training of trainer model, but we have over 100 master trainers who are trained in these curricula, and the training really occurs through them with facilitation by the Institute of Social Work, where Leah is from. We've also done some training with social welfare officers throughout the country. There have been a number of sort of spin-offs from this program that were not things that were built into the plan, but we're very excited about. One is there's been some expansion away from the mainland to Zanzibar, where there has been a request for us to do training with social welfare officers as well as members of parliament about this model. We've also developed TestWeb, which is schools, a number of other schools throughout Tanzania. There was 1 or possibly 2 to begin with that had social work programs. Our project is also providing technical assistance to a number of those schools. The program model has been transformed and adopted in Ethiopia with a slightly different focus on people with HIV, and as we speak we're doing training. The training center is doing training in Nigeria based on our model, which has been sort of converted to the Nigerian context. The parasocial workers have formed a national support organization for themselves called PASANET. To whatever extent possible, Jane Addams College, where I'm from, has stepped out of the active training, and at this point it's conducted entirely by local partners. And the last one, I really can't say we relaunched the National Tanzanian Social Work Organization, but we supported that, and U.S. National Association of Social Workers is now doing a lot of technical assistance and support to make that sustainable and to help move to the next phase. The lessons that we've learned, I won't go over these in detail, but we think the program has been effective, and our initial evaluations of the training are very positive. And the fact that we've been able to localize it and institutionalize it on the local level is particularly important. I do want to stress that the program is not just training of parasocial workers, but also supervisors working within existing structures. I should add that there is a plan underway, a scheme of service that has been adopted by the Department of Social Welfare to have social welfare assistants. These are people who are recruited from the parasocial pool. They complete a one-year certificate, and then they will be going in the field as employees working as part of the Department of Social Welfare and will become the supervisors of the parasocial workers. We do the training in Kiswahili. We tried doing it in English at one point, but it works much better in local languages. Even then, we have some who come who are not that adept with Kiswahili, which is the national language, but that's how we do the training. And we also try to address issues of stigma and discrimination. So I want to end with another picture showing you sort of the whole model, the parasocial worker, the client, our coordinator, and the parasocial work supervisor. And asante sana, thank you very much. We may need to fix this slide because you can't see exactly, but that is the website where you can access some of these curricula. And we've listed some of the key partners working on our projects.
Okay, again, you can write in questions in the chat room. We've already got some, and if you want also to be daring, you can raise your hand and we can call on you and see how that works. Let's start, Nathan, you got a couple of questions about the curriculum, and one was, can we get the curriculum from Tanzania as well as the standards of accreditation that you're using? And then secondly, there was, and I think it was related to one of your last points where you said it works better if it's in kind of the language, local language, but there was a question about, are there any modules in English, and then can these be shared?
Right. Hello. Okay. So the last slide that I showed had, or the one before, had the website for the Twinning Center. And if you go in there and go to the section on the Tanzania project, you will get access to the 8-day version of the Parasocial Work 1 curriculum in English. The curriculum exists both in English and Kiswahili, although it is a challenge to keep those in line with each other. There are some structural differences in the language, and so one of the issues has to do with language. And when we are involved directly with the training, those from the U.S., the training is conducted in English with translators. The training is actually conducted in Kiswahili, but what we say is often said in English. My Kiswahili is pretty limited, as is most of my colleagues. But at this point, almost all of the training is conducted in the local or in the national language.
Okay. Good. A question that came up is sort of related to training and curriculum, so let's stay on it. What instruments are you currently using for needs assessment? Or what framework are you using?
We started by using the ecological model and using the EcoMap as one of the primary assessment tools, which people really loved. Which, if you're not familiar with eco-mapping, it basically looks at the system of the family system in terms of who's in the family, who, and what are the relationships between those people, and also looks at community institutions that are related to the family. And actually, people draw a picture of that, and that's how we started doing the training. And people love doing it, but in fact, in terms of implementing it and doing it on a regular basis, they loved it in the courses, but whether they did it or not out in the field, we weren't so sure. So we use a case identification form that looks at various services that are provided, which is a national form. In addition to that, we use the Child Status Index, which is an instrument that was developed in Tanzania and Ethiopia to assess the needs of vulnerable children. And that's the basic assessment form. And then they generate a problem list from there and list those on a service plan and try to address what their intervention plans are for services. So the model still is a systems model, looking at various resources that are available or aren't available, looking at the strengths as well as the problems, and then we move on from there. I will say that professionals really like these models in the classroom, but when they get out into the field, sometimes they will say, well, I don't have time to do a formal assessment, I just have to move in and provide services. And from our perspective, that's a problem, because we want them to really think holistically about the child and the family situation and not just what the presenting problem is. So we spend a lot of time trying to get them to work in that area.
I think we'll take, there's a couple questions that have come in about the link between parasocial workers and the social work profession. Just that one question was that, and another one said, how do you link parasocial work services to the other service providers?
Okay, the link between parasocial workers and the social work profession, the model is social work based. It's also case management based, if I didn't say that during the presentation. And so really they are one as far as the linkage goes. In Tanzania, there are social welfare officers assigned geographically throughout the country. So there's always a social welfare officer available to the extent that they are available. And that's because some of them have very large caseloads. They will tell us they have tens of thousands of people in their caseloads, and they're providing direct services and counseling as well as more institutional kind of referral work. I'm talking about the social welfare officers who are the social workers currently. Within the Tanzania Social Work Association, TASWA, there's a membership category called associate members, and the parasocial workers may join there. But as I indicated, there's also their own association that they've developed, and they've done that sort of from within. So that's how we're linked into the social work profession. They're very well integrated, and many of at this point we're supporting scholarships for approximately 50 of them to go and get further education, primarily certificates, so they'll be qualified to be social welfare assistants at some point in the future. I think I've answered at least the first part of the question. Jim, if there's a second part I missed, let me know.
If there's no, I think that was fine. But this is, now we're going a slightly different direction. I got a couple more questions about, in some ways there are questions about the twinning approach and how exportable it is to other countries. And in particular, somebody asked if there were any Portuguese-speaking institutions or resources.
Okay, well, I think that in order to become involved in twinning, it would be helpful to either contact the American International Health Alliance or to contact USAID or the CDC within your country and have discussions beginning at that level, because these are PEPFAR-funded programs. Twinning Center coordinates partnerships between like institutions in various countries. Some are considered north-south partnerships, like the Tanzania Twinning Project, where our School of Social Work in Chicago was twinned with the Institute of Social Work in Dar es Salaam. Some are south-south partnerships or a combination thereof, and so, for example, the partnership we have in Ethiopia includes our partnership, both the Tanzania portion and the Chicago portion, as well as Addis Ababa University. So it's basically a south-south partnership with some help from us. In terms of materials in Portuguese, I think you would have to go and talk with the Twinning Center specifically about some materials. I don't think there are social work programs currently in existence in Portuguese, but I know this question has come up before, and there have been some efforts to develop a partnership there as well as to look at some materials. So I would contact the Twinning Center and see how far we can get from there. There may be, I know in Mozambique in particular, there are a number of materials in the health sector that have been developed that might be adaptable to your needs.
Okay, thank you, Nathan. We'll take maybe one or two more. One, in fact, and it's a question that does come up a lot around the parasocial work program once they're finished with the training, and that is the role of the supervisor. And I'm going to read the question directly because I think it's very well put, and that is, it comes from Lesotho. It says, what is concretely the role of the supervisors when you say they are responsible for assuring quality of service? In Lesotho, our qualified social workers are based at the district level, not the community, and we could therefore look at a supervisory or quality assurance role for them, but we need to understand what that means. So any thoughts you have about that?
Well, we feel it's important that the parasocial worker has kind of a go-to person to come to with questions or concerns, as well as someone who can help them to identify what their assignments might be and how they might implement them. So we train the supervisors using a model that focuses on leadership, on monitoring and evaluation, on the day-to-day work of supervision in terms of dealing with challenging or difficult cases and the like. So the issue is there a supervisor and is there an effective supervisor, and can they really be involved in the monitoring aspect? So the communication with supervisors is probably primarily by mobile phone or face-to-face, but they may not be in the same location. Like you talked about in Lesotho, the model in Tanzania is a district-based model. When we've done this model in Ethiopia and Nigeria, it's less of a district-based model. The advantage of having that kind of model is there is an accountable person to work with, but whether that supervisor is able to really establish accountability and monitoring for the parasocial worker, it probably varies from place to place. Even though we've been in place for 5 years, it's really still a new model, so working out some of those issues, that basically we have a temporary system in place at this point, at the point at which there are social welfare officers and social welfare assistants employed by the government who are supervised by the social welfare officers. We'll really have sort of a 3-tiered system in place, and we think it will improve at that point.
Great, Nathan. Just one last question that relates to a different one entirely. It relates to child protection issues. And does the training focus at all on abuse and violence, and or could it be adapted to train to deal with issues of child protection?
Well, the answer to that is yes and yes. Issues about trauma and violence are covered in the Parasocial Work 1 training, and there's almost a whole day focusing on that topic in the Parasocial Work 2 follow-up training. And we've tried to modify our language to reflect more of a child protection focus and approach, but it is integrated throughout, as you would expect that it would be given with this population of children. So they're informed about legal issues, they're informed about how to get additional kinds of assistance, as well as how to deal with crisis related to abuse and neglect, issues of sexual abuse and physical abuse and psychological abuse. All of those things are covered. So it's built into the model, although it's not featured as the only component of the model. I think that it is quite adaptable, and we've been working with various groups and how we might expand that portion.
Okay, thanks very much, Nathan, for the broad range of answers to the different questions. And kind of, again, just a reminder that the session is being recorded. People can refer to it later. And we also have some ways that we intend to kind of follow up with questions that don't get addressed in the future. So we'll say a bit about that at the end of the webinar about how we're going to do that. So we need to move on then to the next presentation, which is by Lynette Mudekunye, who works for REPSSI in Southern Africa and is looking at a community-based work with children and youth. So with that, we will turn it over to Lynette.
Hello, good morning, good afternoon. I am speaking about a certificate program that has been developed by REPSSI together with UNICEF, and that is being delivered in conjunction with the University of KwaZulu-Natal and the African Center for Childhood. It's an 18-month accredited certificate for community-based work with children and youth, developed by a group of African academics. The main focus is linking what people who are working with children already know to theory and making sense of that, equipping the social service workforce at community level with new and relevant skills and knowledge. The curriculum was developed with a lot of support from UNICEF over a number of years, beginning with a needs assessment through the old KABA forum, an institutional survey of training programs, stakeholders workshops, a curriculum development workshop, and then finally writers workshops to actually write the material. REPSSI then partnered with the University of KwaZulu-Natal to accredit the course at a short certificate level and develop the assessment, which is a formative and summative assignment for each of the 6 modules. Together, we established the African Center for Childhood to develop quite an innovative delivery mechanism. It's situated, which means students do not leave their work. They are actually studying at the same time as they are working within their communities. It's supported. They get together in groups of between 12 and 20 students with a mentor for 1 day in every 3 weeks when they have a facilitated workshop session together. And it's distance, which does not mean online, because where we're working, very few of our students have access to the internet. It's all in hard copy. But the material and assignments all go, every student has a copy. They're able to study at their own pace and get together. And their assignments are sent to an academic institution where they're marked. The 6 modules are there: personal and professional development, children's rights and child protection, child and youth development, care and support of children at risk, integrated development in communities. And the 6th one is a service learning project, which is practical, and the assignments are the preparation for your practical project and what you learned in doing that practical project. The modules were initially tested in a residential setting at the university, and then the full certificate was piloted and evaluated in 8 countries, beginning with 553 students. The finding of the evaluation was that there was an unprecedented retention rate of students, and this was really largely due to those mentor sessions, coming together, having that time to share what they are doing, what their problems are, and working with a mentor to work through them has been fundamental. The program had equipped community caregivers with skills and knowledge to respond to the challenges of children, and it had a really deep influence on them, particularly around their understanding of children's rights. Currently, we are running the 2nd delivery of the certificate in those 10 countries. The first 5, it's being run directly from the University of KwaZulu-Natal, so all assignments are being marked at the university. In the other 5, we are working with a local institution in country, which is now delivering the certificate and doing the marking. It's moderated by the University of KwaZulu-Natal still. The students are recruited in close collaboration with a variety of partners within country, usually government, UNICEF, civil society organizations working with children and youth. They have to be people who are working with children and youth, and they are able to read and comprehend the materials in English, and we're now translating into Portuguese. It is both women and men. It varies country by country. There are some countries where it's many more women than men, others where it's roughly equal, and 1 or 2 where there are a few more men than women. The age range is between 20 and 70. And it's really incredible to see how that whole age range can get together. The students come from a wide range of backgrounds. Many are community caregivers. There are teachers, social workers, social welfare assistants. The police has been very interesting, particularly those working in child protection or victim-friendly units. There are child protection assistants in some countries and NGO field workers. Training happens at 3 levels, primarily through the actual hard copy modules that they read and study from, as well as 3 practical REPSSI tools. The second level is the mentors. All of the mentors have a tertiary qualification, experience in working with children, and good facilitation skills. They're working in the same area as their students are working in, and they all receive 3 weeks of training. The third level is the module coordinators, who set the assignments, mark them, and when they send them back, they send them back with quite extensive comments. It's not just a mark. These, in the countries where we're working with the local institution, are supported from the University of KwaZulu-Natal. The impact is that students are really much more aware of children's rights, particularly participation and protection. It's having a profound impact on how they work with children and how they advocate for children's rights. They're able to observe children, and they now know what to do, how to get help for the children. They've really been empowered personally, and that's a quote from one of the students in Tanzania, which says, "We all thought working with children was a passion, and we now realize it's actually a profession. There are ethics, there are principles, and there are theories which govern how we do it." There are enormous challenges in delivering a program across 10 countries and to some really remote areas. Assignments must get from those areas to the academic institutions, and there's a tight turnaround time frame. We've learned that the mentors need more training and more support. In the first round, we were very fortunate in getting extremely good mentors, but if you're going to extend it further, you need to build in that training and support. We've learned that the academic institutions have almost never worked with this particular SSDL methodology, and so they need support in just adapting to it, and this is being developed. We also really need very strong advocacy with the relevant government bodies to recognize the qualification. The certificate is now being made available in Mozambique. The materials are being translated into Portuguese. We're planning to extend to Botswana, and we are seeking accreditation in South Africa. If you are in one of the countries that is on the map, you can contact REPSSI through our website or through my email, which is there. And it is possible to deliver this certificate in other countries where there's an academic institution which can do so. The long-term vision is to expand to more students, more countries, and have more local academic institutions delivering it. To accredit the certificate in all of those countries, so far Swaziland and Uganda have taken the program through their accreditation bodies, and it has been accredited. Beyond that, we are working on the development of a diploma and a degree. We'll also realize that there's been a huge demand from teachers who are really the front line in working with children in many, many places, and have not had this training on psychosocial support for children. And so we're developing a particular certificate for teachers. In terms of advice, frontline workers with children and youth really are very passionate, and they have a lot of knowledge about children and youth. So we recommend that whatever programs there are should build on that existing knowledge, but be easy for them to understand and use. We really need a lot more training for the frontline workers, a lot more support, and we all need to work on how that can be sustainable and how the work which they do can be sustained. Thank you, and good afternoon.
All right, thank you very much, Lynette. That was very helpful. And we're going to take a few questions, and there was a hand being raised there. Oh, good. Good, but we'll call on them. What we would like to do, actually there were some questions about French and about French language materials and about the availability in previous sessions. And there was one here, Lynette, that came up, which actually may have since disappeared. I think it had to do with, are there any perspectives with French-speaking countries? So, yeah.
Not currently, but the material, as I've said, has been translated into Portuguese, so it could be translated into French.
Okay, thank you. There was a question about potential career ladder where the program is available.
We believe that the field of working with children and youth needs more than one profession. You need a range of professional qualifications to really provide a holistic service. And so today we've spoken about social work, we've spoken about child and youth care work. We believe there is space for a multidisciplinary degree such as we are proposing, which would draw on sociology, social work, psychology, and be focused really on psychosocial well-being of children and youth.
Okay, and thank you, Lynette. And as you will notice, in some cases, people are both asking questions and then others are also answering or amplifying on the answers. So this is another helpful way so communication is happening at different levels. Other questions? Yeah, this is one related to, there was a very specific question about Lesotho, and that's which institution are you affiliated with in Lesotho?
We had an agreement in Lesotho to work with the Institute of Education of the National University of Lesotho. However, the National University has undergone reorganization, and that institute has been absorbed into the education faculty. So we are currently back to starting again. We are looking for an institution, and if the person with the question has any ideas, we'd really like to hear from them.
Okay, great. Are there other questions out there? What is the question? We do have a question about.
I'll just raise it.
Right.
So this is Mari, and I'm just, I wanted to ask to what extent this training program teaches casework, basic casework skills.
It's not a casework-based program. It is really, the focus is on psychosocial support, children's rights, child protection.
Okay. Any other questions before we move on? Anybody have a question they want to ask by raising their hand? We saw somebody did earlier, but then they disappeared before we could call on them. Okay, then let's go ahead and move on where we get a chance to either discuss or think about all three presentations. Thank you very much, Lynette. And take a look at the question that we have for you. You know, some of you are doing this in offices in small groups. Some of you are doing it alone at your computer. we're going to just give you a minute or two to think about this question, and because there have been a number of ideas that have been discussed about the three different presentations we heard, and so we're curious about sort of implications for your own work. In particular, how might some of these ideas be applied to social service workforce strengthening in your country? So we'll just be silent for a minute or two. If you're working with a group, you might, in a particular country, you might discuss some ideas, and then we would like to hear from you, actually. Okay, Kathy has raised her hand and wants to make a comment. And Kathy, I think you can turn on your microphone.
The question that I would like to ask is the connection between training, especially accredited training, and career pathing and developing a profession. I think quite often we train people and we train them really well, but generally if people are connected into a profession that they're going to be moving towards, they actually get a greater sense of belonging. There would be conferences, journals, literature. So they have that sense of professional development or career pathing. And so I'm actually querying and wanting more discussion around the issue of training versus connecting to career pathing.
Okay, so you would like some more discussion about the connection between training and career pathing. Okay, let's see if we could get somebody who would like to say a few words about that.
This is Nathan. In our training, we try very hard to link this into a career path for a couple of reasons. One is we try to identify young people to be trained as parasocial workers. The good side of that is that they're fresh and may stay in the field for a while, but the difficulty is that oftentimes they go on for additional education. So I think one of the reasons why they even come into the program is because they're hoping to be linked into some kind of career path. So in our case, they come in as parasocial workers. They can go on for additional training and become social welfare assistants. They can then go to an academic institution and get a certificate, diploma, a bachelor's degree, or a master's degree in social work. So our particular program is tied closely to social work. But we do think that it's very important to be a part of a career ladder. Otherwise, I think one of the other issues that we're going to confront has to do with attrition. People will come and do this work for a while, but unless we have some supports in place and some future hope for continued development, we tend to lose people over time.
Okay, thanks, Nathan. Any other additional thoughts about that linkage between the professor or the training and kind of professional advancement, career ladder, or something like that? All right, Kathy, is that you? If you did.
Thank you very much for that comment from Nathan. I think it was extremely helpful. I think that what is challenging for me is that around the world, if you talk about a social worker, you know who a social worker is, no matter which country they come from. When you talk about a doctor, you know who they are, no matter which country they come from. But somehow when in the children's workforce, we're looking for a name to identify who the person who's focused on working with children are. We seem to get a range of different names. And I think that rather than uniting us, it might separate us. I feel like we're needing to look at who is the worker who works in the children's workforce, and how do you actually look at uniting maybe a couple of names. I think when we mentioned child and youth care workers, we were also saying that we know that in Scandinavian countries they are called social pedagogues, but we know that they're child and youth care workers. But we know that basically your grounding, your training is the same, and your delivery to children comes from the same methodology. Methodology is quite important. I think that's why I asked that question. I just, again, would like to hear more comment around that.
Okay, Nathan, you raised your hand.
I think that it's important to say that when we talk about parasocial workers, this term has become a little bit contentious. In different countries, different terms are used to address that as well. I think by identifying it with social work, it clarifies it some, but for example, we do a program in Ethiopia where they're called psychosocial care workers. And there's a number of reasons why they chose not to use the term parasocial work. So I think this issue of terminology is a real limitation for all of us, and we need to figure out ways to move ahead with that.
Okay, great. Thanks, Nathan. George Palmetto has his hand up. So why don't we give him a chance? Hear from George, and if he activates his microphone, we can talk about that. There are a couple people that have advised that. And there was a question about where is TASW based, and then what does the acronym stand for? I think that was to Lynette, wasn't it?
This is Nathan. TASWA is a Tanzanian Association of Social Workers, and it's based in Dar es Salaam, and it's linked very closely with the National Association of Social Workers USA, and I know we have people from NASW who can talk more about that if they would like to.
Amy, do you want to say a few words about TSAW?
With the NACCW is the National Association for Child Care Workers. We're a professional association that actually holds biannual conferences, has a complete membership structure of members who are child and youth care workers throughout the country, workers who work in different settings like residential care, including the Izibindi model and community. We have a journal that we have that actually creates communication and information about the child and youth care field. We have international liaison, so we work with other child and youth care workers internationally. We are connected into the CYC net, which is an electronic communication on information in child and youth care work. And of course, we've been doing the appropriate advocacy and training, and the training that Kathy had talked about. So in a way, all our child and youth care workers have access to an identity and a movement that is actually working towards the recognition and professionalization of child and youth care workers as a critical children's workforce in South Africa.
Okay, thank you very much, Sunny. And we had somebody raise their hand very close to the webinar central here. Maury?
Sure. There have been a few questions about how we can collect more information on accredited training programs around the world. And it was suggested that we invite participants in this webinar and people who weren't able to attend the webinar to submit information about those programs through obcsupport.net. So I'll say a few words about obcsupport.net at the end of this webinar, but I did want to say that could be a great place where we could collect that information and begin to maybe do a more thorough analysis. So even if you're not participating in those training programs but you know about them, let us know about them and we can begin to collect some sort of directory. Also, if you have more information about other training programs or curricula or evaluations that you would like to share with other people, we can post that on obcsupport.net as well. It's a great resource.
Okay. Any, again, back to the general question about the application of some of these ideas to social service workforce strengthening in your own country, either through the chat room or by raising your hand. As we're thinking about any particular, again, applications, there have been some questions again about Francophone materials, and Maury has a few ideas about that.
Well, I guess maybe this is a discussion question as well that I can throw out to everyone. It does seem like most of the materials that are available and available to be shared at this point are English or in English. And I know that our friends working in Côte d'Ivoire and in Haiti and in other places have some training materials as well that are available and that could be shared, and they may also be interested in adapting some of the materials that we talked about today. So maybe a question for presenters is, what would be the opportunities for extending your programming, the REPSSI programming in ACCW, the Twinning Center programming into Francophone-speaking countries, Portuguese-speaking countries. And then also, I just wanted to also encourage our Francophone-speaking participants and Portuguese-speaking participants right now to share those materials again on obcsupport.net because maybe there are opportunities for you all to share amongst each other some materials that have already been translated and tested in Francophone context.
Okay, so any of the presenters have any thoughts about the kind of extension of these materials? Kathy does, so Kathy, why don't you go ahead?
Just to say that we would be, from the NACCW, National Association for Child Care Workers, very willing to explore that possibility. Because we are connected with international child and youth care people, we have strong child and youth care workers, for example, in Montreal, in Canada, who have the French background, who would be able to assist, I suppose, with translation, so that the essence of child care is not lost in translation. So I think would be able to even connect in other French-speaking child and youth care workers would be able to provide training and be supportive to French-speaking countries. So just to say that we would be very willing to be part of any process that looks at that.
Any of the other presenters want to say a few words about that? About the either French-speaking or Portuguese-speaking kind of extensions of the materials?
This is Nathan. I can tell you that the issue about adapting and translating materials is a little bit more complicated because you have to really tailor it to the country that you're working with. And so I think if materials are posted in whatever language, it would be helpful and useful. But I do want to let people know that there will be a process in order to make them user-friendly for the context that you're working in.
Well, and I would also add to that, Nathan, a comment we got through the chat room from Nankili, which was, as we share the materials, the only caution I would share is for users to respect the copyrights of the different materials. So even if adapted, kind of giving credit from where the materials come from. So, okay, I'm going to take us back a little bit to a comment when Amy Best was going to talk a little bit about the association in Tanzania. And she basically has written in the chat room, which a comment which I will read. It says, by providing ongoing professional development and continuing education to association members, TASFA and associations in other countries can build on training provided by other groups and ultimately work towards government-approved accreditation standards. So that's one of the functions that a stronger professional association can provide. And there's an additional comment which Maury will read.
Well, it looks like there's an additional comment building on what Amy has been writing into the chat window about TASA, just indicating that TASA is at the forefront of coordinating the emerging universities of Tanzania, and that this body, it sounds like, wishes to start a social work education program in Tanzania. But if someone wants to clarify that comment, then please go ahead and write in or raise your hand and speak up, and you can tell us more about it.
But are you looking for more information about what we call TESWEP, the Emerging Social Work Education Program in Tanzania? Is that what you're asking?
Sure, there was a comment, a follow-up comment to a comment by Amy Best, and if you would you like to provide a little more information?
Okay, well, there are at least 10 schools within Tanzania that have indicated interest in forming and starting accredited social work programs at various degree levels. In Tanzania, there are a couple of accreditation bodies that formally accredit educational programs through the Ministry of Health or the Ministry of Education. One of the challenges we've had is how to provide teachers for these programs, because in a country that has a limited number of people at higher degree levels, for example, we worked very hard to start a master's program in social work, and there is a master's program in sociology and social work that's functioning in the country. But the supply of qualified instructors is a big problem given all of that. But notwithstanding that, we formed a consortium of 10 or 12 schools that have come together for a number of times to identify needs, to look at international standards around social work education. We did a workshop, Introduction to Social Work Education, and spent 5 days with various faculty. It was quite multidisciplinary and focused. about social work education. And actually, we put that onto a video that we hope to make available to people at some point in the future. And also to provide technical assistance to the varying schools to help them get ready for accreditation of their programs. We think that we'll also have to provide some help in terms of mentoring instructors as some of these programs get launched. But this is actually an effort that evolved out of a request that was made to work with one of the institutions, Open University of Tanzania, but as we looked at it, we realized there were many others around the country, and even some programs that were existing and functioning that we really didn't know much about. So that has become a component of TASWA. When we've talked about what TASWA is, the Tanzanian Social Work Association, and it has an independent advisory committee that is overseeing the activities there. We're also developing a resource hub of educational materials that will be available for all these schools and hopefully eventually to the students as well as the faculty. So that's kind of a process that's underway at this point in terms of how to develop that. It turns out there are some resources within the government specifically to assist with developing that kind of resource hub, so we've been able to tap into that. And the issue there very often is for faculty of schools of social work, they may already have access to reasonable kinds of materials, but it's really an issue more in technical assistance and marketing to get them to utilize those materials, which is very challenging in an environment that has limited bandwidth in terms of the internet. So people will very often ask us to bring books and hard copy of materials, which we're happy to do, but they become outdated fairly quickly, and with internet access, things are much more available on a reasonable basis. So we've done a lot of work in terms of how to provide technical assistance, even in a setting where internet access is limited, how they can take advantage of what's there. So those are some of the things that we're working on in terms of the Emerging University program.
Thank you, Nathan. Lynette, you made a nice comment in the chat room, but it came only to the moderators. So, and you talked about both what you've been doing, just a reminder about what you're doing in Mozambique and with Portuguese, as well as how adaptable these are across countries. So could you just raise that, just talk a little bit about that to the whole group?
I put it in the chat room because I'd spoken about it earlier. As I said, the materials were developed by a range of academics across the continent and have been found to be really applicable across those 10 countries, even though there is a wide range of different contexts within them. And there is a small group in the certificate program this year in Mozambique, while the materials are being translated into Portuguese. They study in English but can write their assignments in Portuguese. So there is that possibility to translate the materials, and it could be translated into French.
Okay, thank you. Just a different question that came up earlier that, again, is related to the kind of application of these ideas in your own country. Somebody noted that the models that were presented and tested seem to be working, and that they asked what is, in this case, the specific question is, what is USAID's plans for moving forward? But we could probably substitute UNICEF or other people, other kind of both multilaterals and bilaterals that are working in the area. So I would be curious as to anybody who might want to speak to that. Okay, Kathy, go ahead.
Just to say that the replication of the training in other countries is something we're already negotiating, as we said earlier, with Zambia. And I think that the development of trainers in different countries is quite important. What we did with Zambia is that we trained trainers, and we handed over our non-accredited training and created a way in which Zambian trainers have become experienced in very basic childcare training. We are now in the process of replicating the Izibindi model, which is a model of working with children in communities, but we are offering a more advanced non-accredited training that we had developed to Zambia as well, and we are going to be training trainers in October. So I'm sure that there are possibilities of exploring the accredited training with building capacity in communities to do that training, in different countries to do that training themselves. I think with the accredited training in South Africa, some of the statutory requirements, the verifications, the assessments might not be necessary in other countries or might not be applicable. And I suppose that's what we would need to clarify. But I think it would be a very, very good idea to experiment with the way forward.
Okay, thank you, Kathy. A minute ago, Benjamin Kirchin raised his hand. Do you have a microphone, and can you comment? We have another question here, and that is, have any of these training programs made linkages with the African Association of Schools of Social Work? Good off again.
This is Nathan. Our program, the Parasocial Work program, has connected with the African Association of Schools of Social Work, both in terms of presenting at their conferences and in terms of participating in some of the programs. I think the conference that was presented at actually was the international conference that occurred in South Africa a couple of years ago. So there have been some connections there, as well as with the project in Ethiopia that uses the similar model, has been very actively engaged there.
Okay, thank you, Nathan. I think what we want to do is take one more comment, and that is from, we've noticed a couple comments that Anita has made, and we might ask you to expand on those. Do you have a microphone?
Hi, I'm Margaret Roper from the Curricula project in South Africa, and we've developed accredited skills development programs that are aimed at community caregivers, and they focus on building the community caregiver psychosocial well-being, and as well as child protection. And we've got a supportive supervision curriculum as well. And these are accredited with the Health and Welfare CETA, and we implement them around the country.
Okay, thank you. What would you like? What we want to do, we get a number of questions, and actually in this last part of it, also a number of people that responded to each other in the chat room. Again, that will be available during the recording. It'll be on obcsupport.net. So we would like to go ahead and wrap up, and I think Nathan has a few concluding remarks, and if we can find them here, and then Maury's going to wrap it up with some kind of things looking ahead. So Nathan?
We've seen a number of models that indicate that community training with frontline workers can be developed and works in various ways. We've also talked about some of the differences based on the sort of professional connection of the training team and the needs within the country and different models that are there. There needs to be established values, ethics, and guidelines to ensure the programs provide quality service. And those are in various stages of being developed. Courses should support ongoing professional development and career ladders. And I think we've heard that it's very helpful to have a link into professional associations either in country or to partner with professional associations outside of the country, as well as having a strong link with academic settings, whether they're schools of social work or schools of other related areas that would be helpful. And maybe it's also very important to stress that programs shouldn't be isolated. They should be part of an overall workforce development plan. We talked some about career ladders. We talked some about how graduates will be absorbed into the system, how graduates may be absorbed into future educational programs. We talked a little bit about the policy context and what the regulations are and how the governments within these countries may pick up and support these programs. And we talked some about sustainability. We talked a little bit about the impact of the training, but we probably don't have the kind of data that we need to move ahead in that area. We've talked a little bit about how to get to rural settings, and I think all of us talked about how somehow the program needs to go where the people are and where the needs are rather than be done centrally. We've talked some about the quagmire of terminology. We come from slightly different places with different approaches, but many of us are talking about similar models, but not exactly the same. So maybe at some point we'll need more discussion about that. And we've also talked a little bit about language issues and how we can bridge the differences between different cultures and different languages and how we can move ahead from there. So those are some summary comments that I hope are helpful. And I think from there, Maury is going to talk to us a little bit more.
Great. Well, thank you for giving me the final words. I really just wanted to, again, thank all of the for preparing these presentations, for being available for questions, and I wanted to thank all of you participants. It looked like at one point we had possibly over 60 participants today, and I wanted to thank you for all of your excellent questions that were provided through the chat window, for trying out raising your hand and for using your microphone. I know that this technology is still new to us, and I think we're still working out the kinks. But I'm excited to engage in this conversation with you. It's almost as good as being together in South Africa at the last year at the Social Welfare Workforce Strengthening Conference, but maybe not quite as nice. I wanted to just remind you that this recorded session and the PowerPoint presentations, as we said, will be available on ovcsupport.net within the next week. And as we mentioned, we also want to continue these discussions on ovcsupport.net. So if there were questions that you had, that you asked that weren't answered, or you didn't understand the answers because the line wasn't very clear, please post those questions on ovcsupport.net, and we will provide instructions about how to do that and make sure you know where those forums are. And we're going to ask the speakers to monitor those forums and to answer those questions. We've also made a note of a few of these unanswered questions that were specific to the programs that were discussed and some of the more general questions, so that we can just kind of start these discussions off with a few of those. I also wanted to just make sure that those of you who aren't on our listserv already have an opportunity to join the listserv, because we'll also be pushing information out through that listserv about new webinars. We're going to, potentially be sending more information about programs or speakers that will be featured in these webinars. And then if you have ideas for additional webinar topics or any other suggestions or requests for information, you can send those requests to swws.webinars@capacityplus.org. So please be aware, our listserv is growing. It's very exciting, and so we're going to try to use that more and more. I also wanted to let you know, just to give you a little, to let the anticipation build for the next webinar. Although we can't get together in South Africa again this year in November, our next webinar will be in November, and that will be the first anniversary of our Social Welfare Workforce Strengthening Conference. It was held in Cape Town, South Africa last year. So we wanted to use that anniversary as an opportunity to check in on the progress, on your progress in the countries that you're working in and living in, and to see what you've been able to achieve over the last year, how you've been working together to strengthen the workforce, and maybe also some challenges that you have been facing that you would like to raise and like to think through with others in this global community that are working on similar issues. And so perhaps we can think together about solutions to some of those obstacles. If you are a country that would like to be featured during that webinar, please let us know. So you can let us know through the listserv email address, the swws.webinars@capacityplus.org. I also just, because it had come up a couple times, I just wanted to let you know that you can share information about training programs or about any social service workforce strengthening efforts through ovcsupport.net, and to kind of guide you and let you know where all of our pages on social service workforce strengthening are currently on ovcsupport.net. You can access that through going to the programming tab at the top of ovcsupport.net. And do be aware that we can't post anything ovcsupport.net can't post anything they don't have permission to post. So if there's something that's on the web already, we can post a link to it. If you want to give permission and it's your material that you would like to share, then you can do that. And at this point, I would suggest that you, if you want to post things on ovcsupport.net, you can probably just go ahead and send them to the swws.webinars website. And we will also, when we post information about this webinar and future webinars through the listserv and on ovcsupport.net, we'll provide more specific instructions about how to post things. So on that note, I see that it is 11 o'clock. So we have been fortunate to be able to talk to you for 2 hours, and we'll sign off at this point and look forward to talking to you in 2 months. Thanks again. Goodbye.